I'm working on a dream. Tuesdays with Dr. T at WIDU Studios, alongside the big man, Chuck the Engineer, then my co-host, Pastor Dennis Shepard at United Methodist Church in Hope Mills, North Carolina, home of the beautiful Dry Lake.
Yes, good morning.
We've talked to you about healthcare for months now after the big Obamacare that went through, and these problems in healthcare have existed for a long time. And it's my pleasure to have somebody in the studio who understands this as well. He is a family practitioner at a Village Family Healthcare Center located on Fort Bragg Road, and his name is Dr. David Parker. Welcome, Dr. Parker.
Good morning. Thank you.
Tell us about your practice. I know that you have you incorporate PAs and nurse practitioners in your own practice, and tell us a little about your own practice.
Well, what we do, we're family practitioners. We also do GYN, pediatrics. Our main focus is we treat a lot of different diseases, from diabetes, hypertension.
Right.
Some of the common things, we do hospital care, ICU, but our main focus is more natural medicines. Our goal is to get patients to, as you said before, to realize they have a part in their health care, and they can actually gauge that. They can control what they do. And from a natural point of view, not to get hooked on pain medicines. And same story as you. A few weeks ago, a couple of months ago, I injured my shoulder. And I did the same thing. I didn't want to take pain medicines, and I, didn't want to diagnose myself, so I went to, Dr. Tyler's clinic, Nelson Chiropractic there on Yakin Road. They diagnosed my shoulder, took appropriate X-rays, and we treated it naturally. Now my shoulder's feeling great.
Great.
But
Wonderful.
It's to allow patients to see they have a choice. You can, try to take control of your health care, do things more naturally. Even when it comes to diabetes, hypertension, it's the same thing. But mainly just to control who you are, control your weight, control your lifestyle. And that kind of predict how your health is going to go. In most cases,
That's holistic medicine that you practice, Doc.
Oh, yes. In a way, yes.
And it must be rewarding.
Holistic.
A lot of times I'll talk to people that are in the field of medicine, and you see people that are sick constantly. But it must be rewarding when you start to see that you're not only are you treating the sick, but you're taking people that are sick and making them well, and they come back to you when they're feeling better, they're feeling the improvement. And one of the things that I really enjoyed talking to you about was the nutrition. You teach nutrition, you actually do seminars. Can you tell us about that as well?
Yes, well, we do seminars now in the general public here in Cumberland County. Most of our seminars held down in the Medical Arts Building, and we also do some in our clinic right there as well. And we're actually getting into some gyms now. We started going to Fellowship Fitness and even a CrossFit gym here in town.
Wow.
And just teaching natural medicine and just kind of controlling your lifestyle. That's the biggest thing we talk about. And actually, we've seen over the years now, we've seen a lot of people actually come off their medication, including diabetic medication, their hypertensive medication, just by controlling their lifestyle. And it started with me. About 85% of my family are diabetic, hypertensive. They're, have limbs missing, and I just told myself I don't want that to be me. So, I just made a conscious effort. When my sugar started going up, my blood pressure started going up, to just treat it naturally, lose some weight, lost about 30 pounds in about a 6 months period by just changing what I ate, doing a little walking. Not trying to run a marathon, just walk, and it worked. So we get patients to do that pretty much every day, and it's not uncommon in our clinic to see patients on a monthly basis. They're coming off their medication just by natural means.
And you're monitoring their diet and their nutrition intake.
Oh, yes. Even pain control. We have several patients I can mention that even have like fibromyalgia, very hard, difficult to treat. Change their lifestyle and their diet, and they're pain-free.
We see patients that do come in with fibromyalgia, and chiropractic is a hands-on application. You've got your hands on patients. You're moving bones and segments and joints and tissue, and that seems to help. I mean, just that sort of approach seems to help. A lot of fibromyalgia patients have given up because they've been on pills for many years. How do you feel about this? The advertisement of "Ask Your Doctor." Do you get faced with that all the time? I mean, this is a new phenomenon in the last 20 years where pharmaceutical industry has been able to directly access patients by directly advertising and forcing them to ask their doctor about a drug. What is that like in your office? Tell me about that.
I will say it's a nightmare, but it's not. It's fun. I do a lot of medical missions. You're traveling. You only see that in the United States. So much advertisement. They come in and they have the something printed out from the internet. And unfortunately, most of the time they have the wrong information. You turn on the television, they got miracle cure drugs all over the place, and then the side effects are very quick. It's a blah blah blah, but the side effects. So they come in with probably unnatural. The expectations are really off the board.
Right.
And then you have to just tell them that this medication is not for them. And most of the time, most of the cases, that is the problem. But advertisement,
Right.
Yeah.
There's a pill for everything in this
Oh, yes, it
country
is.
now.
Oh,
You
yeah.
know, I mean, I never heard of restless leg syndrome when I was in
Yes.
school.
Yeah.
You know, what is it? What is it related to? The nervous system? Is it vascular? You know, but patients will come in and tell me they have restless leg syndrome, and you know, sometimes you'll find out that they're sleeping the wrong way, or it's cramps, or they're exercising the wrong way. But in their mind, it's restless leg syndrome and needs some sort of
Right.
resolution.
Dr. T, the one that got me was when they came up with the idea of shift syndrome. People that worked,
Yes,
third shift
yes.
at night.
Work shift.
And all
Yes.
those people that worked in factories all those years, or farmers that, got up and worked at night, or people in restaurants, police officers, firefighters. Your body got used to the cycle of when you worked and when you slept and so forth, if you took care of yourself. But now they got a medication for it. So
Yes.
it blows my mind.
Well, you know, they're finding ways and means of treating, this disease. And the doctor, the main responsibility is to try and fight disease, is to
Yes.
try and create a sense of wellness.
Right.
Right.
And nutrition, exercise, eating right, diet, nutrition, something that we all can do a better job of. I'm Dr. Nelson. We'll be right back after these messages.
I firmly believe inside of everyone there's nearly endless potential to do anything, to accomplish anything. But you gotta take that first step toward it. It's really the toughest part, to motivate yourself in action. And when you do, you'll find people along the way to help you towards your goals. And soon, you'll be able to help others reach their goals as you achieve your own. Take that first step.
Coach Nelson, you have a lot of work to do.
If only life was like football. Life was like football. Like football.
Okay, Filagi, I want you on this rotator cuff. Serta, we're going on these headaches. And Cunningham, for goodness sakes, we got a disc herniation in the lumbar. Do you understand me?
Yes, sir!
Tension headache, migraine, hut.
Coach T, hut.
Nelson & Nelson Chiropractic Centers and the Fayetteville Warriors. Take it away, Warriors!
We care for you.
Village Family Care Center is down on Fort Bragg Road. I'm Dr. Nelson. We're talking with Dr. David Parker. In your own practice, do you see what do you see as the main cause of disease in your practice? Is it the diet? Is that the
I would
foundation?
say lifestyle. Most people come in and they may think they have things that are genetically inherited. But when you say genetically inherited, probably 8 to 12% of diseases are genetically inherited. They're inherited because we inherit the lifestyle of our ancestors. So you have diabetes that running rampant, or hypertension through our family because they live the same lifestyle.
Right.
So I would say the lack of a good lifestyle, healthy lifestyle. I mean, people forget blood pressure disorder, even though it's in your family, and diabetes, you can control it.
Right.
And I know some people don't like hearing that, but I like to ask patients, when they come in with issues, the first thing I try to ask them is, what have you done to help solve this problem?
Right.
If you have blood pressure issues, have you changed your diet? Have you cut out the salt? Have you started exercising?
Right.
Do you do relaxation techniques if it's stressful?
Right.
And when they tell me they haven't done these things, I mean, the first thing that we want to do is tell them to do something. Now, when I first came out of medical school years ago, that's what we did. When a person came in with even a new onset diabetic, we didn't start medication.
Right.
We told them to drink a lot of fluids, to change their diet, decrease your carbohydrates, your bread, rice, pasta, stuff like that, and to decrease your potatoes here in North Carolina.
Yeah.
But now,
Rice,
by the insurance company, they tell us, look, you need to start medication. But most of the time, these people can be controlled without medication if they're willing to change their lifestyle. But unfortunately, some of them, they rather have a pill than change their lifestyle. They don't want to take responsibility.
It's much easier to pop a pill.
Oh, yes.
It's
But
something.
with a lifestyle change, you can, with lifestyle change and one pill, avoid having to go to insulin.
Oh, yes.
Yeah.
In most cases, yes.
Yes, if you do it right.
Yes.
That's what I did in my own case. I type 2 diabetic. I take a Januvia.
Yes.
And my highest A1C has been 5.7. So I've got really tight control with lifestyle. But the pill itself won't do it. That's why a lot of people make a mistake. And,
Exactly.
And I did the research and did the reading on it myself, and it says very clearly, and it is genetic. You're right. My mother, my grandmother, all of them. But I don't want to inherit the effects that they had from
Right,
it. I
right.
can
You
avoid
wanna
that.
keep your limbs.
I want to keep my limbs. Yeah, on my kidneys,
Right.
everything.
The
Yeah,
dialysis doesn't look.
I don't want to go that route, bro.
Right.
Yeah.
In addition to that, there's also this huge market now where people that are suffering from anxiety, depression
Oh, yes.
on the rise,
Yes.
and
Yeah.
medication. Now, in the past, patients. I have a friend that's a psychologist. His practice is down. People are not seeking his counsel. They're going to the urgent care, and often they're getting prescription medication. We know that there's a huge black market now where these drugs are out there and being sold almost to the point where the pharmaceuticals are now even more of a threat than illegal drugs because of the need for some of these pain medications. What do you account for that? I mean, are Americans that depressed? Are Americans that anxious?
Probably the last 10 years off and on, I've done addiction medicine, several places here in Cumberland County. And you asked the question, is the depression, anxiety issues, are they going up? I would say probably not in most cases, but things that I found out, and this goes back to lifestyle again, family units.
Yeah.
When you have a family unit that is broken, the children really don't have a parent to talk with or good friends to give them good advice, and things happen in their life that could be tragic. You come up with things like PTSD. It's not military related always.
That's right.
Domestic abuse.
Yeah.
So it kind of goes back to the family unit. But unfortunately, like you said before, and that was very important about, going to urgent cares or whatever to get medication in this area. Benzodiazepines alone, make up for so many deaths on a monthly basis here.
Right. Yeah.
And people are getting them from the streets. They're getting them from their friends. They're getting from their elder person in the house that may be taking them for some other reason.
Right.
And in Cumberland County in particular, our rate of that is over the probably past decade, 2 decades, has increased significantly. It's really, really bad.
Yeah, part of the problem is, Doc, is that people have lost the coping mechanisms we used to have years ago when we had, more family-oriented and community-oriented and those kind of things, friends. And so with a lack of coping mechanism, we turn to artificial means, which is medicine, because it's so easily available. You can go to the urgent care and get it.
In our clinic, even though we're family practitioners, probably 50% of what we do is we treat anxiety, depression, sometimes even bipolar disorder.
Right.
And I've noticed on the last 5 to 7 years has increased.
Yeah.
And one thing you mentioned before was counseling. I mean, I worked in the emergency room last night even. I saw several people, and the first thing I mentioned is, have you sought out counseling? And they say no. They've taken their friend's Xanax or something like that. But when you mention, because the thing about it, you want to get to the problem. The heart of the problem. If you get to the heart of the problem and face it, you can solve the problem. You don't want to just throw a drug on it and put a Band-Aid on it and just slide it under the couch. So
there is a
with
need.
symptoms, not cause.
It seems like we're going, in every aspect, we're going for the simple fix.
Yeah.
In the past, I'm sure that there was a referral to the psychologist, to talk, or the counselor, or the pastor, right, to talk, to discuss some of these issues affecting our lives. I'm Dr. Nelson. We'll be right back after these messages.
Nelson & Nelson Chiropractic Centers is your first stop following a car accident. No waiting, minimal paperwork, and doctors and staff that put you first. Pick up the phone and call Nelson & Nelson Chiropractic Centers. We don't just say we care for you. We prove it in everything we do. Now, take it away, Debbie.
Nelson Chiropractic Centers. We care for you.
We're in the studio with Dr. David Parker. He is the owner of Village Family Care Center located on Fort Bragg Road, and we're talking about a different approach to healthcare.
Yes.
What I enjoyed talking to Dr. Parker about is his approach as a medical doctor to wellness. And here's the interesting thing. We spend $2.7 trillion on healthcare. Every single one of us should be walking around feeling wonderful, right? And we know that that's not true. So why is that the case? Okay, why is it? Well, in general, really the system is set up for disease care. I mean, it's just really about taking care of people
Management.
and managing their diseases as opposed to prevention. Now, why do I say that? Well, in Dr. Parker's practice, Dr. Parker talks about nutrition and lifestyle and advises and counsels and tries to get people to address their healthcare needs by addressing some of the issues in their own lives. Most of that is not covered by anybody. So most of that is an out-of-pocket expense for people, even though we're spending $2.7 trillion in healthcare, $600 billion in pharmaceuticals each and every year. The advice that he is rendering, which would be similar to what you were used to years ago as your family practitioner, it's not covered. And Doc, isn't that hamstringing your approach to how you want to treat your patients?
Yes, and you mentioned about medication really to manage disease state, because you want to be healthy. You want to kind of sometimes not cure your disease, but you want to manage it, hopefully without medication. So even if you start medication to a certain point, you want your lifestyle to catch up with that too. You no longer hopefully need the medication to a certain degree.
The things that you like to teach patients about, like nutritional advice, for instance, that's not covered by insurance, is it?
No, it's not.
And your ability to counsel with patients, that's not covered by
It
insurance.
used to, but
Right.
now, and it's even getting worse as we speak. We
Right.
had a meeting in my office Monday, and the same thing about it. Insurance, if you come in and you have a person say is obese,
Right.
and you do counseling and you offer them, lifestyle changes that really do work, you can bill for it. You're not going to get paid for it. But
right.
on the other hand, if you write medication for it,
Right.
it's not gonna, even trying to say lifestyle changes a gym membership.
Right.
That could also, it would be to me much cheaper than paying for expensive medication. They won't do that. It's natural, it's more, lifestyle changes, more natural lifestyle changes, they won't cover it.
And that's part of the insanity of the system. Dr. T and I've talked about it before. We put the emphasis on treating the symptoms, managing the disease, rather than on preventive medicine. And
Yes.
for many, many years, medical care was largely based on how do we prevent things.
Right.
You get inoculations before you start school, so you don't pick up these diseases.
Yes.
If you change your lifestyle early on, like today, we got a lot of kids that are junk food junkies.
Right.
And we know they're going to end up with a lot of symptoms, obesity, diabetes, all these things. But we could prevent that now. But
Right.
but that's not funded. That's not considered a priority.
Well, yeah.
Like it is to, hey, get them into your office, you diagnose them, get the blood work
Right,
back,
right.
write the prescription.
Yeah.
And that's wrong-headed because that's not holistic.
Well, that's again, it's the expenditure and where the money's going. Not every problem is solved with money. We see
it's
this
not.
in every aspect of our lives. In education, we see it in every aspect, in healthcare as well, where we have Americans spend more money on healthcare than any other nation in the world. $9,000 or $8,000 per individual per family, median family in our country. So think about it. What are you getting for that price? And I talked to Dr. Parker about this, and it seems like it would almost be better for people to pay the doctor that money. Right, and then get yourself a catastrophic policy like these policies offered through AFLAC for dismemberment and accident and hospitalization. You can get those policies for $30, $40 a month, and maybe it's best to try and give the money to the doctor and let him create a situation of wellness for you.